Penile implant surgery. Your questions and answers. Brought to you by fixED, www.fixed.net.au.
So let's step back a tad and recognise that it takes two to tango. And all of my couples that come in are very concerned, basically from 2 points of view. From the man's point of view, he does not receive the signals from his partner to engage in spontaneous activity for fear of failure, and they usually withdraw. From the woman's point of view, they feel that their partner has lost interest in them, because many men do not know how to broach the issue of their inability to make love adequately to their partners. Generally, the woman partner then doesn't trouble their husband, so you can see we've set the scene where frustration reigns supreme, and very unfortunately, some women feel that, well, then their partner must be getting their sexual satisfaction elsewhere, all from the sake of just not recognising the physiology of ageing that causes impotence. So this drives home the point that adequate explanation of the ageing nature that causes impotence is very important to explain to especially the woman, let alone the man, that there's no loss of attraction here. It is simply that the body has physiologically failed in a very important organ called the penis. So where to for a man who finally admits that he does have a physical problem and he braves talking about his issue to his general practitioner? Let me just mention that not only men and women have trouble coming to terms with the inability of a complete sexual life, some doctors don't feel comfortable about talking about sexuality, not because they're of any particular reason other than that maybe they missed that lecture at med school, or they just like to keep it private, so that for the poor unsuspecting patient, let alone fessing up to what is a very personal question to perhaps a very friendly and well-liked and respected GP, they tend to seek help elsewhere. So there's a little bit of a warning here that if the first approach to their typical normal general practitioner meets with less than satisfactory directions as to how to and what to do, they shouldn't be put off by this and seek help elsewhere. Certainly once they get a referral from a sympathetic general practitioner, it's probably best to send it to someone, a specialist generally, and usually a urologist, who is interested in the mechanical correction of erectile dysfunction, who has a very easy attitude towards sexuality and relaxes not only the man, but also his partner, and explains the physiology. And it is absolutely wonderful to be able to explain to them that it is an ageing process, it's not psychological, and here we have a magnificent way of correcting his problem. So yes, definitely seek advice, but be prepared to have to seek it far and wide. So in summary, it's most important to seek out help and advice from a urologist who has adequate training and willingness to talk about this subject, and go to it.
Penile implant surgery. Your questions and answers. Brought to you by fixED, www.fixed.net.au.